American hospitals will see patients infected with the Ebola virus. That's the prediction of top doctors right here in Middle Tennessee.
U.S. Senator Lamar Alexander met with them today to see if they're prepared. News Channel 5's Andrea Klein-Thomas tells us why he says Ebola poses a threat. Andrea.
Right now, the virus is contained to West Africa, but there's no vaccine, no cure, and half the people infected die from it. All reasons why Senator Alexander says you should be paying attention.
A future vaccine to prevent against the Ebola virus may be formulated in this Vanderbilt University lab.
It becomes a cancer cell in our lab that makes an Ebola antibody.
They already created new drugs here that could kill the deadly virus in humans, but its effectiveness and safety still has to be tested before being mass-produced.
But getting them scaled up and tested at a magnitude where we could transfer them to West Africa, there's a lot of work that needs to be done.
Meaning it's not an option for the West African countries ravaged by the disease that's already claimed the lives of 2,800 people. The Centers for Disease Control estimates more than 1.4 million could be infected by January if more is not done to contain it.
Ebola, a case or a handful of cases will at some time come into the U.S.
The question is not if, but when the virus will make it stateside.
We are prepared to handle an Ebola patient if we encounter them and would welcome that.
Good news for U.S. Senator Lamar Alexander. The ranking member of the Health Committee sat down with infectious disease doctors at Vanderbilt to discuss the potential impact on Tennesseans.
We're only hours away, I suppose, from an infected person from West Africa showing up at the national airport.
While the epicenter of the Ebola outbreak is thousands of miles away, Alexander warns it poses a threat right here at home.
I still think that we need to take the Ebola crisis as seriously as we take ISIS.
Vanderbilt conducts drills that simulate how to treat someone who tests positive with the virus. Meanwhile, the president has sent troops, healthcare workers, and medical supplies to West Africa to help stop the virus from spreading.